Walker back. We're hoping we can do the young adult groups and the peer specialists and the community of practice and whatever else we can add. And of course, to do this, we're looking at funders besides ourselves. So we also will continue with the interagency piece and try to get those folks supporting the agenda that we've really been working on here. So we see this as kind of a beginning. The community of practice, I think, is a wonderful way for folks to have discussions and to impact direct care in ways that I haven't seen before. So I'm hoping we can sort of expand this. As we all know, it depends on kind of, you know, leadership support and the great dollar. So,
and actually,
but a lot we think we can do. I mean, I think we can really start moving a lot. So,
and Emily's really interested in this process of the community of practice and trying to find out how effective this is, and maybe using it in other areas. So she wants to really learn more. So I think she will support this going forward. Yeah. And like Ian said, some other things that will be helpful.
That's great, because like Malika said, I feel that we learn so much from each other, and just getting together, and it makes you feel refreshed and energizing, and then you bring that energy back to your team. And it's really hard to keep it going if you don't have a way to bring people together to continue to foster that because of all the challenges we have. And really, I mean, it's true that, you know, productivity, all these things that we talked about today generates productivity, which is great. I think more of the challenges is the paperwork demands that bog people down, that consume so much of their time. And then, so we just got to think of creative ways how to balance that out, and definitely less caseloads is definitely a good place to start.
We piggyback on that. We started a CLC committee at our agency, and so that required so many questioning about, you know, especially from the staff, how often would it meet, the vacations from the committee, and developing sort of a system within the committee itself. We've had several meetings already, and it's been great, and we've had a discussion with our director as well on how to make it happen in a way that we're sort of going to do. It's going to be sort of like a systems of care. So we're going to meet every so often. We're going to provide lunch for the staff to come in during the lunch hour. We're going to try to be respectful and start on time and finish on time so they can get back to whatever they're doing. But we have committed staff. So again, it's just the beginning, but it's starting well. And last Friday we got together and spent actually 2 hours just getting to know each other, talking about what the culture meant to us, and biases. We're going to continue to do that work, and our human resources director is also involved. She's very involved and wants this to grow and wants to take this sort of to the whole agency. So she's been providing information and has come to our meetings. But there's more planning to do.
I think it's been helpful, like as we kind of started brainstorming best practices through our gags and through these meetings and the work that we're doing. I think now it's a question of, you know, which practices are we saying are the best practices and that have demonstrated, like now that we're using them, like how can we go? Because I think my understanding is that eventually, you know, we're trying to inform all the CSAs of how to, you know, interact with this population. And so the challenge is, how do we continue to kind of foster that energy, and how do we get out to the other CSAs, and how do we figure out what are the, you know, interactions that we want to get out to the other CSAs to say, try this, and hopefully engage these young adults more.
I think that just to add what Ann and Sue said, in regard to where do we go to next, whether, as I said, whether we get the funding or not funding, is that if the community of practice, all of you, see this as value added, you know, to your work, we'll find ways to continue this. What format, I don't know. But I want to just give you an example of organizing the this today in regard to kind of the preparation programmatically, because I don't know what Annabelle and Meredith does in terms of getting the place and so forth, in terms of the venue. Organizing in terms of just the ideas, what we focus on, and so forth, is actually quite simple. And all we really need to do is to send out the email, have a few phone calls, contacting Mary, contacting Natalie, and Natalie also get Amy involved. It's really not that much work. If you look at it, if you all kind of think back and say, wow, this is really very useful for me to have, then it's very, very simple to get that aspect done. So I see that if this is coming from the community of practice and saying, these are the maybe 1 or 2 or 3 topics that we really want to focus on, using this process that we have established as a community of practice, that's really not that hard. What is hard is that you, in some sense, as the champion, I guess, you have to convince your authority or your line of whatever commands to say that I need to go and attend this, so that you can then bring it back and say, okay, this is what we have discussed. These are some of the very concrete, actually, recommendations that we come up with. And I think when Natalie earlier said, actually, that's the beauty of a community practice. If it's really working, ultimately, if you create that sea change, it's actually about policy change as well. She talked about, reduce the number of families served and so forth. I mean, ultimately, I'm not saying that's going to happen tomorrow, but ultimately down the road is because of community practice, you create a policy change. And you look at a lot of literature, that's what happened to community practice. It is because of folks that are really doing the groundwork and saying, hey, this is working really well, that's not working. But that's way down the road. So I guess answering your question, I think there are ways that we can maintain this, whether it's through emails or we even talk about maybe a dedicated kind of a site. I don't know how much work that is in terms of membership only. Let's say the community of practice, this group, and continue with some of these dialogue, maybe bringing folks together. And I don't think that is a costly endeavor per se. But I think ultimately, it's still, each agency is to say that we have time for staff to do that. And I think that's the question that I have. So that's really is a challenge. And we have to see how we can do this. Are there anything else, in terms of your personal interest, are there anything else that we, and kind of not answering the we, but I think there's ways that we can help you. What can we do in terms of maybe even information? Because one of the areas that we actually have not talked about that was brought up here is about workforce recruitment. Are there anything that we can do, at least provide you information or connect you to, if not already, some of the multicultural ethnic community gatekeepers, so that you will be connecting with them, and then you can work with them in regard to recruitment and so forth. Maybe that has been done. We don't know, because we haven't spent the time here using this process to talk about what some of the challenges are. Would that be helpful? Are there any other things that you think that you would like, as champion, you want to proceed and working with your organizations? We heard an example of Gandhara. They're moving towards, they created a team called Cultural Action Team or Linguistic Action Team, and they want to move that agenda forward, as an organization. So that's, their kind of focus. Are there anything else that we have talked about that you are interested in? Is that still too big of a challenge?
Well, for me, it's still about trying to figure out ways to help staff identify what deeper culture is and how to draw that kind of information out from their families. Because I feel like that's the biggest challenge, is like to explain it is like one thing, but then to like practice it is another. So like that's my continued challenge coming back to my CSA,
yeah.
But also, as we continue to do the work, is kind of identifying those ways.
What's the next step? You're kind of following up in terms of the challenge. What's the next step that we can be useful? Would it be useful if we, let's say, do a survey monkey and just getting a sense of what do you need, so that at least maybe we can provide you information, if not, kind of the process, community practice kind of discussion. Would that be useful if we send something out, to you? I'm just thinking about, some of the very successful, even icebreaker that number of organizations saying that, after OMA introduced that, we use that, for ourselves in our own organizations. And so I'm just thinking, being practical, should we actually send you a list of icebreaker exercise? Actually, I got one from the System of Care Training Institute down in Florida. It is actually some of the great exercise and focusing even on, I don't know how many of you know the X and the O, which is a great kind of icebreaker exercise that talk about differences, and so forth. So I guess those are the things that I would love to hear from all of you, with you on our email listing to say that what would you be interested, at least if not for information for you.
I'd love to see the icebreaker exercises.
I have to say that I'm not sure. I don't know what I don't know.
That's true.
Yeah.
And that's why being here where conversations come up helps, because I don't know. There's so many areas that, the area that she spoke to, the area of the workforce, the area of balancing the medical model and the, being culturally competent, and how it doesn't really balance, and how when you're in your realm, they really, the business office really is interested in the medical model and making sure you're keeping that, and we have to be the champions of the balance and all of the above. So what you're asking is like really broad to me, and I don't know how to say all the things that I think we could use to be better. That's my
That's
honest
actually a
answer.
good comment. Good comment.
There was one of the earlier meetings where people talked sometimes about videos that could, you could have, after the video, you could have cultural conversations. We did that in our, another project I was in, and it was really great as a kind of a trigger to talk about a certain